Hello, welcome back. So that will bring us to now talk about the scope of tests that you can see at the tertiary level, maybe teaching hospitals, and the scope of laboratory tests you see at the state level, and the scope of laboratory tests you see at the primary level.
World Health Organization has an essential diagnostics list. The challenges of the Nigerian ecosystem sometimes means that some of the essential tests may not be available in all facilities. But for primary health care, to the best of my knowledge, what we have are like the basic tests that relates to malaria diagnosis, some of the blood level tests. You may not readily have full blood counts, but you would have PCV, maybe things like strip or serology-based tests or antigen antibody-based tests. So those are things that the technicians can still handle with minimum supervision. Now, for the secondary level care, you would have more of the tests that cater to an advanced diagnosis. Then the tertiary level covers more of the advanced tests. So in the primary healthcare center, you may not have tests like hemoglobin A1C, which is used to monitor diabetes. You may not have that in the primary healthcare center, the manpower. But definitely in the secondary level, you have that. Same thing in the tertiary. Some primary healthcare centers do have things like gene experts for TB, tuberculosis diagnosis, because of the work of some implementing partners or like non-governmental organizations, which try to ensure that, okay, you have healthcare access brought to the level of the poor at no cost, APIN, IHVN, and so they could have CD4 tests, gene experts for diagnosis of TB, acid fast bacillitis. Those ones, you could have them in some primary healthcare centers, so long as they have people who are able to run the tests. But mostly, some of these tests are concentrated in secondary level care. So you have referrals. You now have the primary healthcare center functioning as a collection center where they collect the samples or they refer the patients to take the samples to the secondary level facility. The secondary level facility will be attending to patients coming from several primary healthcare facilities. So in that wise, you could still say the primary healthcare center is also running some of those tests because they are the owners of the patient, or they are the ones that are actually taking care of the patients, and they referred the testing. But when you're talking about tests that are actually done on site, tests that are done right there in the primary healthcare lab, you may not go beyond some very basic tests, packed cell volume or malaria parasites, rapid test, like rapid test. You may not go beyond that really, because that's what most of the medical laboratory technicians are able to do unsupervised after a little bit of training.